you, Deputy Presiding Officer. Trevor, I'd like to call for a statement from the Cabinet Secretary for Health on GP provision in rural areas. I've had shared with me an FOI response from the NHS Wales Shared Services Partnership, which shows that only one small primary care premises has been built in Wales in the last 10 years. That lack of investment is quite troubling, certainly given the disproportionate impact that smaller surgeries can have when they're built in our rural communities. It's also troubling that 99 GP surgeries across Wales have closed in recent years, which creates a further barrier for those rural communities. And one example which comes up in my region is that Hanmer surgery, which has been recently covered in a Channel 4 television programme, highlighting the quality of care that people receive there, but also highlighting that the premises is not fit for purpose and that investment is required. Local people are frustrated at the pace of progress, which is painfully slow. So I'd like a statement addressing what will be done to bring those GP services closer to people who live in rural Wales.
Well, thank you for that question. I mean, access to primary care services is crucial because it delivers better access to doctors, nurses, dentists, optometrists and all those other health professionals who are central to transforming services and is a government commitment. And I mean, I think it's important just to, for the record, that every month GPs make contact with 322,000 people in North Wales. And they refer 30,000 people into hospitals or secondary care each month. The First Minister was responding to a question on this earlier on. And also, the fact is that there are practices that have experienced recent challenges around staffing, and there are financial incentives for GP training in Wales. The Targeted Incentive Scheme in Wales provides £20,000 to GP trainees who take up a training post in North Wales, in Ceredigion, Pembrokeshire and Powys. And I just say that just in terms of one particular medical centre, the West End Medical Centre, a new GP is starting this week commencing the 3rd of June, and a further 2 within the next few months. So that shows the great efforts being made by the practice team to engage, to recruit, to engage with the community, make improvements. But clearly, the Cabinet Secretary and her officials are reviewing progress to improve permanent staffing, not just for that practice, but through other practices to make sure that those GP services in rural areas are supported.